breathtaking article, or one of the seminal article on remodeling, was by these two gentlemen who did an experimental study on leg of the rabbits, and they found out that remodeling happens at two places. One which happens at the shaft, we call it as a bone drift, and one which happens at the epiphysis is known as epiphyseal angulation or asymmetric growth of the epiphysis. So if you have a fracture, this is how it acts. So let me show you in a simplified way. If you have an angulated fracture like this, what happens is there is a more bone on the concave side, the convex side bone is taken off, but majority of the correction comes from asymmetric growth of the physis. So there may be some residual angulation in the mid shaft, but the physis will align well. So physeal growth is related to pressure. So when there is a mild pressure, there is an increased growth on that side, and that is known as a Powell's law. And when there is a severe pressure on the epiphysis, there is a Hutter and Walkman law, which leads to reduction in the growth of the epiphysis. So let's see how the Powell and this law acts. When there is a fracture like this, the periosteum on the convex side becomes tense and concave side becomes relaxed. Because of the relaxation, there is increased growth on the epiphysis, so that side grows more on the concave side, and it leads to restoration of the angulation.